Aloha. In 2012, my brother had an elective open heart bypass surgery. At that time, I was living in Kirksville, Missouri, and my family and I traveled to Michigan to support my brother. I felt the need to support him as both a brother and a physician who could offer osteopathic manipulative treatment, or OMT, which I knew that his surgeons did not plan to provide as part of his care. They were MDs, and I knew that their education in my specialty was lacking. In the post-operative setting, I treated him to make sure that his ribs were moving, that his nervous system was balanced, and that his tissues were aligned to lessen the impact of the surgery upon his body. That's a big picture overview of what the OMT I provided did for my brother. Fantastically, my brother recovered well from surgery, and he was discharged without any complications. Providing post-op OMT for my brother was based on both my personal experience and the research evidence. I have been fortunate enough to be part of hospital systems in Michigan and in Kirksville where post-op OMT was available as part of patient care. Based on these experiences and the research that I had been exposed to during my training and my continued experience as an osteopathic physician, I knew that OMT could help treat or prevent bowel and or lung complications after surgery. I had no interest in my brother having either of those. Also, over 10 years earlier, I had the experience of treating my sister's father-in-law, and he had open heart surgery to save him from the complications involved with a heart attack. The problem was that 2 months after the surgery, he still suffered with chest and arm pains that were not from his heart. Back then, I was just a medical student in town for the weekend, and I looked at it as an opportunity to test what I had learned. The thing is that I had no idea that 77 to 85% of people who have cardiac surgery experience pain within 2 weeks after the surgery. It makes a lot of sense that patients would have pain after open heart surgery. The surgeons make an incision down the breastbone, then saw through the bone and separate your chest, in a way that's unnatural. Over 40% of people have chronic chest pain after heart surgery. That means 3 months later, they're still having pain related to the surgery itself. Yes, they're lucky to be alive, but it would be so much better if they did not have pain after the surgery. In my brother's case, he had no pain after the surgery. His complaints in the following year after the surgery were related to his energy level being lower and difficulties he was having tolerating cold temperatures due to the medications that he was required to take. It took time, but he acclimated to those challenges. And now, 9 years later, he is riding about 90 to 100 miles a week on his bicycle at the age of 70. That's 7-0. The latest recheck of his coronary vessels found them to be doing great. I'm motivated to chat about this now because of a recent podcast I listened to that discussed research published the year after I treated my brother for his post-op bypass. The research was published in the Journal of the American Osteopathic Association and found that patients in the OMT group were discharged from the hospital more than a half day earlier than patients treated with standard of care or with standard of care plus a sham treatment. And not surprisingly, they had their first post-operative bowel movement a half day earlier too. The reason the same half day finding is observed in both outcomes is not surprising because the post-op BM is required in order to be discharged. When I chatted with my brother earlier today to get his okay to tell you about his story, he told me that even after 9 years, he recalls that he had 3 goals after the surgery. Number 1 was to survive the surgery and wake up. Number 2 was to be extubated and breathe on his own. And number 3 was to have a bowel movement. I know that I helped with number 3, which was to have number 2. Anyway, the study by Dr. Whiting and his colleagues also showed a greater improvement in the standardized test that measured the functional independence of patients to do the basic activities of daily living. They didn't publish on post-op pain, and so I can't really report on that. I know that my brother didn't experience the post-op chest pains, and it is a reasonable hypothesis that the OMT I performed on him helped him in this regard. Interestingly, the OMT performed in the in the OMT and bypass surgery was not standard in that it was not tailored to fix the individual patient biomechanical problems. It was a standardized application of 3 different homeostatic techniques that targeted primarily the nervous system and the lymphatic system. The bottom line was to prove that even a minimal standardized application of OMT applied by experienced and relative beginners would help post-operative patients. It did. Personally, I believe that most post-operative patients would benefit from OMT performed by a clinician well trained in this application or a student supervised by such a clinician. OMT for post-op patients or patients with chronic post-operative pain is another example of what the osteopathic profession offers and how we normalize, optimize, and thrive with the Danto Osteopathic Clinic. I hope this finds you thriving. See you next time.